Hello, I'm Rosalind Nieves. Welcome to Queen's Perspectives. Today, I'm in the Queen's Library for a very informal town hall presentation with the First Lady of New York City, Chirlane McCray. The First Lady will discuss community mental health needs along with her signature policy initiatives, that is, ThriveNYC, which tackles mental illness and the stigma that's associated with mental illness. Also, HealingNYC, an initiative that addresses the city's fight against the opioid crisis. The president and CEO of the Queen's Library, Dennis Walcott, kicked off the presentation. Take a look.
This would not be possible without the First Lady. As a result of her initiative, her concern, her boldness, along with the mayor and the de Blasio administration, we, the Queen's Library, like other institutions, have had the ability to launch these initiatives. And I personally want to say thank you to the First Lady, to the mayor, de Blasio administration, and the people who are here to provide the first line of services to our community, to thank them. And also, you'll meet two great deputy mayors, and we have a running joke with each other and introducing each other as deputy mayor, deputy mayor, deputy mayor, deputy mayors, because you'll see a lot of deputy mayors roaming around. And they've been in the really forefront, along with the First Lady, of providing these types of services. And so, it is my pleasure to introduce a man who I have a tremendous amount of respect for. And I don't need the notes to talk about him for a hot minute, because when we talk about the Queen's Council delegation, we at the Queen's Public Library have been very blessed by having a fantastic Queen's Council delegation. We've been blessed by having a fantastic borough president, and they just not visit libraries, they just don't talk about libraries. They put their money where their mouths are as far as supporting our libraries, both through programs as well as capital investments to make our libraries great. And one of the leaders is a person who is a man, as I indicated, who is not just my councilman. He's more than a councilman. He's a man from the community. You see him every time, both wearing his council hat as well as his community hat, and just being a regular guy serving the needs of the people, and that's our councilman, Daneek Miller. Daneek?
Tonight's honored guest, First Lady Chirlane McCray, is really, really at the forefront of mental health. And because of that, because of the work that her and the Mayor de Blasio has done on this issue there, that they have really brought us from the darkness, and particularly in this community, in African-American immigrant communities where we were saddled with the stigma of mental illness and just would not address those issues. It is okay for us to talk about them now. It is okay, and it is evident that from the folks in the room here tonight that we are not alone, so that we can intelligently have that conversation about how do we move on. It is important because African Americans are 20% more likely to suffer from severe mental illness than their white counterparts, right? And nearly 41% of all New Yorkers have suffered from some form of mental illness and stress. So ThriveNYC has given us the tools and the ability to be able to address all of these stigmas and all the things that have historically bound us as a community, as a people, as a society. And I am just so thankful that we can have that conversation and be engaged in the way that we have, that this administration, this First Lady had the vision and the wherewithal to really come out and tell her story, the courage to tell her story, giving us all the courage to tell our stories, and just to be here tonight to see how as a community we get better. And so I'm really thankful that that has happened. I am thankful that this is a really good time to be a part of government, because there's really great things happening here in this city of New York. There are great things happening here, but things that just in a very non-traditional way, but a very necessary way that we get to address those issues. And so Thrive New York and this initiative gives opportunities that through home and community-based services, psychological rehabilitation, educational support services, and employment opportunities, we are really addressing that.
There are some cases in which the stigma surrounding mental illness prevents people from reaching out for help. Here to break down these type of barriers and to have a roadmap to thrive is First Lady Chirlane McCray.
I'm so happy to be with you here. This is wonderful. It's a wonderful library, wonderful community, and we have a full house, which makes me really happy. Yes, thank you. Thank you. I want to thank Dennis Walcott, president of this magnificent library, who is also my Bajan brother. Much appreciation, Dennis. And I want to thank Councilmember Miller for that great introduction and also for being such a strong crusader for social justice. You're welcome. Now, I know there are many others here, and I just want to give you a little shout out. The Alpha Phi Alpha Senior Citizen Center. Yes, thank you. Thank you for being here. The Dream Team leaders. The Dream Team leaders. All right, someone, all right. The Greater Queens chapter of the Lynx. All right. And let's see, Girlfriends Pathways to Empowerment. There you are, there you are. Everyone who's watching via Facebook Live, please send us your comments, your questions. We want to hear them. And thank all of you for coming out tonight to join us in this really important conversation. Now, we have 3 goals for this evening. 1, we want to make sure that you know about all the resources that we have to provide for you around mental illness and addiction. 2, if you have a need, if needed, we want to connect you or someone you love to the services that we can provide. And 3, we want to learn from you. We want to know what's on your mind, how we can serve you better, because we can always do better. But we need to hear from you, because every community is different. There's no one-size-fits-all. So I have a very personal connection to the subject of mental health. My parents suffered from depression when I was growing up. They were fantastic parents. They provided an extraordinary life for us. They were very devoted to family, but I was always asking, like, where's the joy? Where's the happiness? And as a child, I didn't understand why there wasn't this feeling of happiness in the family, since they worked so very hard. And I didn't understand it until later, when I grew up and learned about the signs and symptoms of depression, that what they must have been going through. And it's not just my parents. I have extended family, friends, coworkers. So many people in my life have suffered from mental illness or addiction, whether it's bipolar disorder or depression, alcoholism, suicide even. It's affected me deeply. And it's really part of the human condition. We know that from our studies, from research, we know that 1 in 5 New Yorkers suffers from a mental illness or addiction. 1 in 5. That's a very big number. And last year, nearly 4 New Yorkers every day overdosed from opioids. Every day. That's a lot of people. That means that all of us, every single one of us, are affected by this, either directly or because of someone that we love, someone we care about. Am I right? Yeah. Raise your hand if you've got a story. You got a story? I certainly do. Yes, so this is something that we have to deal with, and that is why we launched Thrive. There's a lot of pain, a lot of suffering, but mental illness, addiction, these are diseases. It's not about a lack of character, a lack of discipline. Mental illness is a disease, and it's all treatable, all of it. Many of us have had so many misconceptions about this disease or number of diseases because they're invisible. We can't see them. We didn't grow up learning what the signs and symptoms are, so it is totally natural that so many of us have grown up believing that it is, moral character, right? A flaw in their moral character, or again, lack of discipline. But that's not true. It is a disease and it's treatable. So we're here tonight because we want to make sure that we're doing as much as possible for you. And I want to share with you just a few of the accomplishments that we have so far. Thrive is a very big program. We've got 54 different programs, most of which have launched, about 91% approximately. I'm not going to tell you about all of them and where we are at them, but some affect you specifically, and I want to let you know that all of our schools now have some form of mental health support, every single one. Now, what does this mean in Queens? Well, in Queens, we actually built 10 brand new clinics, 10 new clinics. And we're making sure that we've offered the Cognito program, which is a suicide prevention program, to 132 of the schools in Queens. Yes, you can clap for that. It's a good thing, good thing. I don't know if you know that in terms of mental illness, that 50% of all cases begin by or before the age of 14. By or before the age of 14. 75% of the time, by or before the age of 24. That means we got to pay attention to our young people. You know, what happens to a disease if you don't do anything about it? It gets worse, right? So in our schools, we can prevent. Sometimes we can actually prevent disease, but we can always treat. We can always intervene to make sure the disease is not getting worse. And that's what we want to do by providing this mental health support in our schools. We're also screening 80% of expectant women or new mothers to make sure that they're not suffering from maternal depression. And we know that roughly 1 in 10 women suffer from maternal depression, which can range from mild to severe, but it's very easily treated. And if it's not, it can have lifelong consequences for that child if the mother can't bond properly to the baby. So we want to catch it, right? You know, as soon as possible. And we're screening 80% of new mothers and expectant women now, including hospitals like Elmhurst and Jamaica and Flushing and Queens, right here in Queens. Thank you. And the last initiative I want to tell you about is NYC Well. Now, so many people have come up to me over these last 2 years and said, you know, I knew something was wrong with my daughter or my son or my cousin. I didn't know what to do. I had no idea, like, who the right person to call would be. And so, as a result, we know that we needed to have a number, a place that everybody could call, anyone could call, no matter who they were, no matter where they lived, no matter whether they have insurance or not. We wanted them to have a place to call if there was a crisis, or if they just needed to speak to a trained counselor so they could figure out what are the next steps to me helping my child or my spouse or even a friend. And we have that number now. It's 1-888-NYC-WELL. And I'm going to ask you to repeat it after me because there's going to be a quiz later. 1-888-NYC-WELL. One more time. 1-888-NYC-WELL. That's fantastic. I know you're all going to pass, but I'm going to test you. And we've had more than 150,000 calls to NYC Well since we launched 7 months ago. Isn't that amazing? That shows the hunger. That shows the need. And we know not everyone identifies themselves because they don't have to identify themselves. But of those who have told us like where they're from, we've had more than 8,000 calls from Queens alone. Right. And one last number I want to share with you is mental health first aid. We've trained more than 3,000 residents of Queens in mental health first aid, which is like, it's like CPR, but it's for emotional behavior. We all know what to do when someone is, they stop breathing, or we know what to do if someone's bleeding, or, for these kind of first aid emergencies, but we don't know what to do if someone has a panic attack, or if someone's suffering from depression. And we should know this. We should know, given how common all of this is, we should really know what to do. And we can learn through mental health first aid, which we are offering for free. We're training 250,000 New Yorkers, and we're well on our way, but we need more people from Queens. So you'll have an opportunity to sign up later. And maybe Dennis will host some more courses right here in the library. So we're going to get to the questions now. I didn't talk about opioids, the opioid overdose, which is ravaging our neighborhoods. We're doing 3 things. I'm going to tell you very quickly. We're working with the NYPD to reduce the supply of opioids. We are connecting New Yorkers to treatment. We want to make sure there's treatment close to them, and anyone can call NYC Well to find out where. And we're also making sure that there are peer counselors available in our public hospitals to talk to people who are suffering, who are at a point when, if they've overdosed, they're very vulnerable. And actually, it's a really good point to connect them to somebody who's already been through this struggle so that they can get the care that they need.
The Deputy Mayor for Strategic Policy Initiatives, Richard Buery, and Dr. Herminia Palacio, Deputy Mayor of Health and Human Services, will talk, as well as agency leaders. Make sure to have a pen and paper ready to take down any information that you think will assist you.
It is my pleasure to be here in Queens to talk about issues that are close to the First Lady's heart, critically important to all of us here in the administration, to really talk about mental health, emphasis on the word health, because this is really about how we can keep individuals, families, and communities healthy, and behave the whole gamut of behavioral health services. In the city, I oversee the Department of Health and Mental Hygiene, New York City Health and Hospitals, Administration for Children's Services, Department of Social Services, and several other agencies, but a number of agencies that are really at the front lines of caring for all New Yorkers, including New Yorkers who are trying to be well and healthy each and every day. So thank you.
It is always amazing to see people come out and talk about an issue that has so long been kept in the shadows. It's really wonderful. So very happy to be here, and thank you all for coming out to talk about this important issue. So again, my name is Richard Buery. I am Deputy Mayor for Strategic Policy Initiatives, which I don't really know what that phrase means, but it means that I do lots of things, and one of the things that I'm very happy to do is to lead the day-to-day implementation of ThriveNYC. It comprises 54 initiatives, all designed to make New York City a place where people can be healthy and be well. It involves agencies across the city, including many of the other agencies that I work with, from the Department of Youth and Community Development, the Department of the Aging, Department of Veterans Services, all of whom are working to make sure that people in New York City can be mentally healthy. One of the things that I'm very proud of is of the 54 initiatives in ThriveNYC, 51 are already up and running. So we are well on the way of this work. We're still at the beginning, but we're well on our way. And it's one of ThriveNYC is built on 6 principles, 6 ideas. One of those ideas is called changing the culture. Another is called partnering with communities. And I think both those ideas are really reflected in the work we're doing here tonight. Change the culture means that before we can really do anything else, we have to have a culture that allows us to talk and engage about mental health and mental well-being and mental illness. Because all the programs we build won't matter if people aren't comfortable seeking and asking for help. And these conversations are designed to do just that. Another principle is called partnering with communities, because we understand that to really transform the way the city approaches this work, you have to build on the expertise and the hard work and the knowledge of local communities. And again, being here today and having this conversation is critical to that as well. So once again, thank you for being here, and looking forward to our conversation tonight.
The town hall style presentation allows the community to participate in a relaxed setting, Next, the First Lady of New York City will take questions from the audience.
We have a number of other senior administration officials who are here to help tackle your questions. I like to think of them as the helpers and healers. Could you please stand and just say your names?
Good evening. My name is Scott Bloom. I'm the Director of School Mental Health Services in the Office of School Health.
Hi, my name is Luke Bergman. I'm Assistant Vice President in Behavioral Health at New York City Health and Hospitals.
Hello, my name is Levi Fishman. I'm Director of Public Affairs for Correctional Health Services, Division of New York City Health and Hospitals. Thank you.
Good evening. My name is Ayesha Delany-Brumsey. I'm the Director of Behavioral Health Research and Programming for the Mayor's Office of Criminal Justice.
Good evening. My name is Michael Hernandez. I'm the Assistant Commissioner for the Administration for Children's Services in their Clinical Practice Policy and Support.
Good evening. My name is Mike Bosket. I'm Deputy Commissioner for Human Resources Administration.
Hello, I'm Susan Haskell with Department of Youth and Community Development.
Hi, everyone. I'm Jennifer DeCarli, and I'm the Assistant Commissioner overseeing the Family Justice Centers for the Mayor's Office to Combat Domestic Violence.
Good evening, everyone. I'm Tobi Abramson. I'm the Director of Geriatric Mental Health for the New York City Department for the Aging.
Good evening, Queens. My name is John Cancel. I'm Senior Director of Behavioral Health Services for Health and Hospitals.
Good evening. My name is Darlene Williams, and I'm the Assistant Commissioner at the New York City Department of Veteran Services.
How are you? I'm Chief Kevin Ward from the New York City Police Department and a Queens resident and former Borough Commander of Queens South for a short period of time.
Good evening, everyone. I'm Becky Fenton from Department of Homeless Services, Mental Health Director.
Hi, everyone. Good evening. I'm Gary Belkin. I'm the Deputy Commissioner at the Health Department for Mental Health.
The first question is from Anonymous. I keep seeing the same homeless people in my neighborhood on the street. Why can't they get into a shelter or apartment? How are they being helped? This is a great question. Sadly, we see far too many people on our streets, and it seems persistent. We do have a street outreach team, and we also, I thank you for raising this question because I want everyone to know there is also an app, the 311 app, that you can put on your phone, and it will target where you are, and you can actually log in where the person is, describe them, so that our outreach team can go to that person and talk with them and build up a relationship of trust to get them to the proper services. Sometimes it takes multiple visits, maybe 5, 6, maybe 20, because someone who is suffering from mental illness and homeless and may be so sick that they don't trust anyone right away. So you can call 311 or you can use the app on your phone. And Michael Bosket, where are you? Yes, could you please carry on?
Well, actually, First Lady, you did an excellent job at answering that question. And I would just say that, you know, all of us as New Yorkers, I think it breaks our heart every time we see somebody who's street homeless. And there are many reasons people are street homeless, so I would encourage, as the First Lady has already instructed, that if you are seeing people in your neighborhood who you're concerned about, to use the 311 app to report those individuals, and those street outreach teams will go out and engage them and work with them, and over time try and convince them to come into the shelter system where they can be helped more. Or to call 311 because that's the best way for us to reach those individuals who we may not already be reaching.
And I just wanted to add that these teams really are out there and they're actually helping. And although the person who asked the question may have seen some of the people who haven't yet come in, through this intensive street outreach that the First Lady and Michael have described, we've actually found 750 people nearly who have come off the street and have gone into either a safe haven or shelter. The city does have shelter available. If we are able to engage somebody to come in, we will find a place for them.
People are dying from overdoses because they're afraid of calling the police and going to jail for having drugs on them. How is the city going to make sure people call for help when they need it? Well, thank you for asking this question, Anonymous. We want everyone to know that saving lives is a priority for this administration. We want people to help save other people. And we have a Good Samaritan law in our state that says if you are helping to save someone's life, someone who's overdosed, that you will not be arrested. You will not get in trouble. You will not be arrested even if you have a small amount of drugs on you or you have drug paraphernalia on you. We want you to save that life. It is very precious. And Chief Ward, would you like to elaborate?
I'll just elaborate a little more. You covered a lot of it. But the law's been in effect since 2011, but a lot of people don't know about it. So if you call 911, even if you have narcotics on you or the person who you're calling for has narcotics, you won't be arrested. We trained all our officers. They all know this. We are starting an advertising campaign on June 19th, so it will be on 1,000 subway cars. It'll be in 200 subway stations, 200 buses. So we're going to try to get the word out that you will not be arrested. And the other thing I'd like to add is that when the officers get there, we have 13,000 officers on patrol having naloxone. Now, naloxone is a substance that reverses the effects of an overdose temporarily till the person gets to the hospital. Since we started this program, 183 people have been saved. So minutes count, seconds count, and if you call, the officers will get there, they'll have the naloxone, and we have more saves this year, 57 so far this year, than we had all of last year. So please call, the officers will be there, you won't be arrested if you have narcotics or the person has narcotics.
Most people bury their story out of fear and shame. What can we do to help remove the stigma and empower others to share and give the gift of hope? Mental illness is not a death sentence. Well, here we are tonight, all of us talking about mental illness and addiction, and that's actually an important step for all of us to take, to not be afraid to share our stories, to know that when we share our stories, it makes it easier for other people to share their stories. And mental health first aid, which we talked a little bit about earlier, is a really powerful tool to helping people understand all the signs and symptoms of mental illness, the signs and symptoms of addiction, and really help people become more comfortable with the fact that these are diseases. Addiction is a chronic disease, like asthma or diabetes. People need medication to stay well. Mental illness can take many different forms, but we do have the power to treat everything. And for too long, we've not talked about any of this because of fear. But there was a time when people wouldn't talk about other diseases because they thought, they were caused by demons or bad spirits. Epilepsy was one of those. But this is 2017. We can do better. And Dr. Belkin, would you like to elaborate?
Yeah, thank you. So I want to make it clear to everybody, I'm available. I'll be here after the session if people have specific desires to connect with a lot of the things the First Lady I know is going to mention, like mental health first aid. It comes up a lot at these the sessions. If you want to sign up for a course, if you want to be a mental health first aid trainer, we can connect you to that either through website or I can see if I can get information. We can connect with you directly. Mental health first aid is a really empowering tool for people. It helps them feel confident to talk about this stuff, to help people that they know. And you are really our army to change the culture. What you do in your homes, in your workplaces, in your communities is really going to help make the difference. And we want to put information and tools and confidence in your hands and in your friends' hands to act on that. And mental health first aid is really one of several ways we can help you do that. So anyone interested, please come up afterwards and we'll get you on that path.
ThriveNYC literally saved my life. I had an episode back in February, and I was under tremendous panic and contemplating suicide. The person I spoke to at the hotline helped me through the episode and provided me with info about services. Thank you for sharing that, whoever wrote this question or observation. Thank you so much for sharing your story. NYC Well has a breadth of services. We haven't talked about all of them, but I want everyone to know that it's a crisis hotline, but it's really much more than that. We can connect people to a mental health provider. We can make follow-up calls to make sure you got to the right provider, or actually stay on the line to make sure that the connection's made properly, and then call back to make sure it was the right match for you. Because if somebody is suffering from depression, they may not be able to get out of bed to get to that first appointment. We want to make sure that people actually get there. And there are so many other services provided by NYC Well. Would you like to elaborate?
Thank you, and thank you for that question and that testimony. We recently, the First Lady and I actually went to visit some of the counselors who man that hotline at NYC Well, and it is I'm sorry, a woman. What did I say? Man. People that hotline at NYC Well, and I'm going to take that story. We're going to take that story back to them because I know they'll appreciate hearing that story. So, like the First Lady said, we created this hotline, 888-NYC-WELL, that you can access by phone, chat, or text, really because one of the First Lady's insights was that one of the challenges in terms of getting help is that it can be very hard to navigate. How to find help? Where do I go? How do I make an appointment? Will my insurance cover me? And so we wanted to create one way that no matter who you are, where you are, what insurance you have, you can go that door for help. So like the First Lady said, it's a crisis hotline, so you can call or text or chat and get crisis support in that moment. We can also help you connect to care by making an appointment with a behavioral health provider. We will stay on the line with you if you like till we get connected to your provider. We will consider whether you have insurance and make sure we're getting you to a place that will help. And finally, if that connection doesn't work for whatever reason, we'll keep working with you until we find the connection that sticks, because that's what's so important, to make sure that connection sticks. The other thing I will say about NYC Well is it's not only for the person who's suffering, it's for anyone who's concerned about someone else. It could be your child or your parent or a friend or your sibling where you just don't know what to do. You see somebody suffering, but you don't know how to help, you don't know how to advise them. You can also contact NYC Well for support and advice on how to care for a friend or a loved one, and how to connect them to support. So we've really been overwhelmed by the outpouring of outreach. I think we've had over 120,000, is that right? Inbound calls, texts, and chats so far. 120,000 people who've come for help across all the boroughs for all sorts of reasons, all sorts of challenges. And one of the most important things we're trying to do is to get the word out, 888-NYC-WELL, the one-stop shop for support.
What's the city doing to keep people who are sick from going to jail? Well, our goal is to keep people who are sick from going to jail. We want to give police the tools that they need to make sure people get to the care that they need. And let's see, who do we have? Ayesha, are you here? Ayesha, would you like to elaborate a little bit more about what we're doing to keep people out of jail who really need other services?
Thank you so much for that question. So I'm with the Mayor's Office of Criminal Justice, and the Mayor charged our office with other city agencies a couple years back with really thinking through this question, and he developed the Behavioral Health Task Force. And the focus of that Behavioral Health Task Force is first and foremost to make sure that whenever appropriate, people with behavioral health conditions, mental health, substance use, do not go into the jail system. And once they're in the system, that they come out of the system as quickly as possible, and once they leave the system, that they're connected with the types of services and supports that make sure that they do not return to that system. And what that task force looked like was that we got over 100 people from across New York City, from justice, from health, people with lived experience, and we asked them, what does the city not have yet? And out of those discussions we pulled out 24 different initiatives that are all in place or being implemented right now. And I'm not going to talk you through all of those. You can get that information online. We have reports about that. But I do want to highlight one that's our last initiative to be implemented that's going to be up and running soon. And that's a partnership with our Department of Mental Health and Hygiene, with the police office, with the police department here. And that's a diversion center. It's going to serve as a really important alternative to police so that they won't have to arrest people who they come into contact with who are in behavioral health crisis and who really need services and don't need to be arrested, don't need to go to the emergency room. They'll be able to take them there. They'll be able to get short-term services, counseling, shelter, wash their clothes, and be connected to long-term services as needed. Thank you.
What should us kids do when we're getting bullied? And who should we tell when we get bullied? Who can students connect with in our schools to get support when we're experiencing bullying or violence? That is a great question. Give her some applause. Very good question. Well, it's very important to be able to talk about bullying and any violence that you experience in the school, and we hope that you would tell an adult. You know, remove yourself from the situation and tell an adult what you're experiencing. That's the first thing to do. But I'm going to actually read the second question because I think they're kind of connected. This is from Anonymous. I'm worried about my godson. He's more distant lately. His grades are dropping and he has new friends that I don't think are a good influence. What should I do? Excellent question. Our adolescents are particularly vulnerable. As you heard me tell you about how mental illness can surface in 50% of the time by or before the age of 14 and 75% of the time before the age of 24. And young people are notorious for making, not the best of choices. So we know from our research that the majority of adults who suffer from addiction, for example, actually started when they were adolescents, started drinking or using drugs when they're adolescents. So bullying, violence, all of these things can be triggers for this type of behavior. We want to make sure that our young people are getting the attention that they need. That's why it's important if you're a student, to talk to an adult about what's going on. We also have school-based services. Remember I said we have some form of school mental health support in every one of our schools. So you can find out who is responsible for that area in your school and get help. And we also have NYC Well. Anyone can call NYC Well. You can be a young person or an adult and call for yourself or for a loved one, and we encourage you to do that. What's the phone number? 1-888. Good, just testing. So Scott Bloom, Susan Haskell, do you want to talk some more about this?
Sure, thank you. To the student, I want to say that's a wonderful question, a very brave question to bring up here tonight, so I applaud you for that. We can applaud him. In every New York City school, there is a program called Respect for All. And when you walk into the school, and everybody greets you when you walk in, there's usually a sign and a big poster as big as those up there that say Respect for All. And they'll have a liaison. In other words, a person who represents the Respect for All program in each of the schools that you can go to. And that name should be prominently displayed. So the Respect for All program is an anti-bullying program. It's against discrimination, intolerance, and the DOE won't tolerate that anymore. So that's a person you can go to, you can speak to confidentially, and talk about the situation that you're in. As the First Lady said, now we are in over 1,700 schools in New York City. There are 375 schools in Queens alone that have mental health services, over 66 clinics that was mentioned that actually have treatment. And we say that you should go to a guidance counselor, a social worker in your school, one of the Respect for All folks as well, and to find out if you have these mental health services that we talked about here. It is confidential. services because we want to protect your privacy. We want to create a safe and supportive atmosphere to talk about the issues that you may be having. And just one last thing before I pass it on. Most referrals come from friends in our schools. There are a lot of self-referrals. And that shows you the trust and the ability for our professionals and our staff to really help students. Because we know teenagers and kids won't talk to any adult if they don't feel comfortable with. So it's a real great service. Let me pass this on.
Hi, I'll just say quickly that my name is Susan, and I'm happy to connect with the person who asked that question to make sure that your the young person that you're asking about is connected to service, because we know what all young people need. They need to be engaged after school with supportive peers and caring adults, learning new skills, trying recreational activities that they enjoy. And one of the mayor's initiative that Deputy Mayor Buery oversees ensures that every middle school young person, for example, in New York City can get access to an after-school program. So I definitely want to talk to you about that. We have drop-in centers for adolescents 16 to 24, including one right here in Jamaica operated by Sheltering Arms. Whatever it is that you need for everybody's purpose, we have an app called Discover DYCD. And you can put in your zip code or your street address and find programs for youth through Discover DYCD. But if you want to talk more specifically, I'm happy to talk to you today.
What services are there for the elderly? I'm so glad you asked this question. Obviously, our senior population is a growing population and a population we value greatly. And so often they can be isolated from other people. And for those who go out to our senior centers, it can be a little tough to navigate. So we now have mental health services and our 25 largest senior centers, and we have a friendly visitor program for those who are isolated from friends and family. And Tobi, would you like to? There you are. Thank you.
Thank you. You've touched on so many of the key points, and we thank you for this initiative because the mental health of older adults is something we don't always remember to think about in the conversation. So as a geropsychologist, I'm always happy to talk about that. We are providing on-site mental health services in 4 senior centers in Queens, one right up the road at Theodore Jackson. So they are open to anybody. You don't have to be a member of the senior center to see the licensed clinical social worker on site. We're also providing psychiatric nurse practitioners or psychiatrists to come in if somebody needs medication and wants an evaluation for that. So that is really an important part of what we're trying to do in terms of we're working really hard on destigmatizing mental health and making it available to any person who's 60 and older. We're providing individual, group, family, couples counseling. So as long as the older adult is part of that, we can see families as well.
How can I set up a mental health first aid training for my organization? I'm so happy someone's asking about this, and because it's free. And we want to do this. We want to train as many New Yorkers as possible. Our goal is 250,000. So we need people to host trainings wherever they are. You can sign up tonight before you leave. You can sign up online. And Richard, would you like to?
Sure. Well, the First Lady just said it. First of all, we're the Thrive Outreach team. So first of all, go talk to them. All right, just cut out the middleman. We, as you heard, we have an ambitious goal to train 250,000 New Yorkers in mental health first aid. That is a lot of people. We need all the help we can get. So first of all, go talk to them. Anybody else, the great way to find out about anything is to go to our website. We have built an extraordinary website. You can access it at nyc.gov/ThriveNYC. You can get information about all the initiative there, as well as information about mental illness in New York City. But one thing on that website is a button that says Mental Health First Aid. I think it's in the upper right corner. So if you click on that button, you can sign up for training for yourself. And if you have an organization that has lots of folks, we can also work with you to arrange a training at your organization. And mental health first aid that we've already discussed gets at the heart of so much of what we do, including facilitating the kind of everyday conversations that we know are critical to giving people the freedom to go out and seek support when they're suffering.
How can parents get evaluated or get help if school can only provide free help for students? Now, I'm so glad that you asked that question because, when no one lives in this life alone. The students have parents, as I did, parents who were suffering. Everybody's connected in some way to other people. But it's sometimes hard to find the right help for you. You may, your life may revolve around your children, and you may think services are available to them, but not for you. I want you to know that you should be able to get services through we have mental health consultants who are affiliated with all of our schools, and they are familiar with the services that are available in your communities. And of course, there's NYC Well. And Scott, do you want to add to this?
Sure. So exactly, just going on the First Lady's comments. So almost 1,000 schools will have our school mental health consultants by the end of the school year, and their job is to link and bring in resources into the schools and link parents and students to those resources. So as parents are looking for services, sometimes the child gets a service first through some of our clinics or some of our other community schools and other mental health models. And then sure enough, we find out that the parent may be dealing with some mental health challenges, him or herself. And it is incumbent on those clinicians and the workers to connect the parents to mental health services in their community. Many of our clinics also do family therapy. So what the beauty of that is parents don't have to miss work, kids don't have to miss school because they're getting the services right then and there. The other thing that I will say is there are a lot of workshops and presentations for parents on helping their children test anxiety, signs and symptoms of depression or anxiety, what to look for their children, their youth. So please take advantage of that and get in touch with your local school to see what kinds of mental health services they have.
How do I help my depressed friend? Thank you so much for this question, and thank you for your compassion. I think that all of us go through this experience at some time or another. We see that someone is suffering or someone's having a tough time, they're in mental distress, and like, what do we do? The first thing is to listen. To listen without judgment, ask the person to talk to you and describe what's going on with them. Again, just listening without judgment can be so helpful and can help you figure out what else you might do to be able to help. You can call NYC Well, or you can give the number to your friend who might want to call. There are so many things that you can do that are positive. I think the most important thing is to remember that not to be judgmental when someone is in pain and vulnerable. Listening is the most important thing that you can do. We also have a youth mental health first aid class that's available to people. And you can get more information about that with our Thrive resource team, Thrive outreach team over there. They'll give you more information about how to learn about the special vulnerabilities, the special issues that our young people go through. And remember, I said that this age is really pivotal, that young people are known for making not the best choices sometimes, and we know that a majority of the folks who are addicted to drugs or alcohol actually made their first choices to use drugs or alcohol when they were adolescents. And so this is something that we really want to pay attention to, help steer young people in the right direction. Listen to them, sign up for youth mental health first aid, direct them to NYC Well, or call yourself to get ideas about how to help. And Michael Hernandez, would you like to speak to this?
I want to say that that's really a great question that you ask. One of the things that we've been able to do is that, and a lot of people don't take advantage of, is that there are preventive agencies like Seaman Society, Catholic Charities, that any parent can walk in and receive services, supportive services in terms of mental health and those kinds of things without judgment, without a case being called in or anything like that. And also, the administration has been very supportive in terms of providing services in the areas of mental health, substance use disorder, case acts, early childhood, as well as adolescence. We went from a staff of 40 in our clinical consultation program to now that the mayor has given us money for over 113 consultants that are available to work with families without a case being called in against them.
Don't go away. We'll be right back with one-on-one interview with the New York City First Lady Chirlane McCray.
Hello, my name's Adela Rodriguez from the New York City Department of Health and Mental Hygiene. As an agency, our goal is to improve the well-being of all New Yorkers, and that includes our mental health. One way to do this is to teach more skills to more people who are often turned to and trusted as sources of help. So we invited leaders from faith communities, immigrant serving organizations, and community support networks from all over the city to share their ideas with us in focus group discussions. We started this online learning center, which will grow over time to provide free of cost virtual training. It's designed to offer you the skills, help, and information needed for helping people who might turn to you. You can use this learning center as a resource for mental health topics such as anxiety and depression. We invite you to join us and spread the word to your partners. We hope you and your community find it helpful.
They said heroin would be the best high I ever had.
Sweetheart? Okay. Sweetie, listen to me.
They said heroin would be the best high I ever had. They lied. Find out the truth about heroin. drugfreeworld.org.
My name is Maria Grazia Cervone, and I'm the coordinator for community learning and development for the New York City Department of Health and Mental Hygiene. In New York City, 1 in 5 individuals will experience a mental health issue in any given year. Come take this course with us. It's free, 3 times a week here at the Department of Health, and you can also request for us to come to you, and we'd be happy to come teach you this course and give you this great resource.
Hello, I'm Rosalind Nieves, and I'm with First Lady McCray, and we're talking about ThriveNYC. Thank you so much for joining me.
Oh, I'm delighted to be here, and all these folks from Queens. It's been a great night.
Well, you have a great turnout tonight. There were a lot of fabulous questions asked by the audience. Am I right?
There were more questions than we had time to answer, which is a good sign.
That's right. Everybody's interested in your topic, which is great. So how does ThriveNYC, how does that push people in the community forward? How do they benefit?
Well, you know, mental illness and addiction are so common. 1 in 5 people are affected at any given time. And that's a lot of people. It means that every single one of us knows somebody or we're affected directly by mental illness or addiction. That means that there's a lot of need out there. There's a lot of hunger. And we saw that tonight with all the questions that were asked about everything from the opioid addiction to what do I do if my son is not acting the way he has in the past. All of those questions really point to the great need here. And we have a number of services that are available, and we have 54 programs in Thrive. I won't be able to tell you about all of them, but our overarching goal is to make sure services are where people live, where they learn, where they worship, and where they go to work.
So that they're accessible.
That's right.
Can you share a story where the initiative helped a New Yorker? Just one story?
Well, I just heard a story tonight about someone who was depressed and thinking about taking his own life and didn't really know where to turn, but heard about the number 1-888-NYC-WELL and called it and spoke to one of our trained counselors and got the help that he needed. You know, when people call that number, we make sure everyone gets the help they need. They can speak to a trained counselor and in a crisis, but they can also get connected to mental health care. We can make sure that they get a social worker or a psychologist or psychiatrist for free. We make sure that they make that connection and make sure they get to their appointment if they want.
Excellent. Are there any additional resources available to New Yorkers with mental illness as a result of ThriveNYC?
There are, and we're very pleased that we've been able to help really thousands of New Yorkers. NYC Well has received well over 100,000 calls since we launched in November. It hasn't been that long. We've only been up and running 7 months. And then we have other programs like our Mental Health Service Corps, our Mental Health First Aid courses, which we are offering to New Yorkers for free that will help people like you and me be healers. You know, we can all help. And I think the more of us who learn the language of around mental health, because none of us really got this growing up, but the more of us who learn we're going to be more able to help people.
And that's the goal.
That's the goal.
That's it for today's show. If you missed any part of the community conversation with First Lady Chirlane McCray, just go to qptv.org to view the entire program online. I'm Rosalind Nieves, and I'll see you next time on Queen's Perspectives. Thank you.